diagnosed. I used to be very thin talaga. Thin, with regular menstruation.
Okay.
But late 2015, sometime around December or November, I was diagnosed with PCOS. That time, ang PCOS, hindi pa siya basically well-explained. Dito na si PCOS nag-strike sa health ko. Nung nag-start akong mag-breastfeed, tapos in-stop ko na lahat. As in, kasi syempre, when you're breastfeeding, hindi ka pwedeng mag-diet. Kaya din siguro, I started having hypoglyce, especially ng afternoon. Tapos, yung weight ko, as in, ang laki ko, I started gaining weight. Super drastic yung pag-change ng weight ko from size 2 to size 8. As in, ang laki. Tapos, ang baba na ng confidence ko. Sabi na ng mga brother ko, mukha na daw akong aparador, mukha na daw akong gasol. Aside from the hypoglyco, drastic weight gain, meron pa akong migraine, chronic migraine. Mainit, malamig, whenever I'm stressed, ang sakit. So, parang binabasag talaga siya. Nahihilo na ako talaga, nagsushoot up yung blood pressure ko. Kahit walang trigger.
How did you come across Simply Nature PPARS?
Nalaman ko siya through Ma'am Jansen and Mr. Jhen. So, they introduced PPAR to me kasi one time we were having lunch. So, very big yung appetite ko. Akong excusin, Ma'am, always tired meal. Ako, he looks 30s, 20-something, mga ganon. So, sabi ko, gusto ko ako din. Kailangan, paglaki ng anak ko, mukha lang kaming friends. When I started using PPARS, first month pa lang. Actually, first week pa lang, I started texting them na, Sir Shyan, Ma'am Jocelyn, I don't have episodes of migraine at all. Kasi yun talagang kita ko. Kasi everyday nafe-feel mo eh. Wala, even if it's cold, it's hot. Yes, kasi sabi nila, ang hirap daw, sabi ng doctors, once you got diagnosed with DM2 or diabetes, it's really hard na i-reverse.
Exactly. How did your doctors react?
They were amazed yung OB ko. First time, kasi OB ko na sila before pa eh. So, first time, since 2015, kahit ako, first time naming makakita ng clear, normal.
Guys, just to let you know, as you can see on your screen, the result actually says ovarian is bilateral. So, both sides. Yes,
bilateral. More than 20. Tapos may specific size pa siya. I can share naman yung lab result. Tapos ngayon, left is already clear and normal. Tapos yung right ko, reduce na yung size. So, working on it para ma-clear na siya. First of all, I wanna thank Sir Shyan and Ma'am Jocelyn. Really, as in, sobrang thankful ako sa kanila. I thank God for their lives. I have nothing but gratitude for them. Having this product improve my way of life talaga, as in. Tapos more pa para yung ibang friends ko, actually nakikita na rin nila eh. Encourage ko na rin sila, medyo nire-refer ko na rin sila. Tapos kaya mo rin to.
Exactly. And just like how Sir Shyan and Ma'am Jocelyn did it to you, it wouldn't be hard anymore because they see the improvement, they see the result on you as well.
Living witness na sila eh kung ano yung nangyaring changes. Good morning, I am Monique B. Marzad, 31 years old. I'm currently working as a property manager here in BGC. I was diagnosed 2015 with PCOS and I started gaining weight, having high blood sugar and then high cholesterol after I gave birth. And then when I started using PPAR, the migraine episodes, hypogly, and my drastic gaining of weight stopped. As mentioned, I started to lose weight and look more vibrant. So I trust Simply Nature.
Before pregnancy, I'm already taking PPARS. My husband and I, we were really taking, I think during the time, we've been taking it consistently for 5 to 6 months already, PPARS tablets. So, I even think that helped us during the this pregnancy because based on our experience, we had 2 miscarriages before my 3rd pregnancy and my successful pregnancy. And that time, we've been told that, oh, it's not healthy, that's why you're losing the baby. And then we're just, waiting on the Lord and praying for His timing. And during the time when I got pregnant, I also realized that, oh, actually we've been taking PPARS. So, because I've read and heard that PPARS helps with cell repairs, it strengthens your body, it's high in antioxidants and all that. You know, I really think that that contributed for us to have a healthy pregnancy. And yeah, that's what I also took during that time. After I have given birth, I really had difficulty because I had emergency CS. So, but after, on the third day onwards, I was actually feeling better. After giving birth, we're gifted with PPARS, so praise God, and that has helped me a lot because they said that the hormonal changes do not just happen during pregnancy and even after pregnancy. So we started taking PPARS also. And I know mommies who have given birth, I know you can relate to this. If you have experienced constipation before birth, when you have given birth, it becomes like more. It gets to the next level of constipation. So I'm glad I was able to take, and I was introduced to Cleansing Plus of Simply Nature even before pregnancy. So when I experienced all this constipation, when I took Cleansing Plus, it has helped me with my regular bowel movements and to be able to release easier and faster. When I felt constipated, because it's true, even after you have given birth, if you're already constipated, it's like it's gonna go to the next level of constipation. I don't know how it happened, but when I read about it, it's all because of the hormonal changes that happens in our body and our body adjusting and healing. So it's going through a lot. It has helped me because especially if you have given birth, whether that's normal delivery or you had cesarean, you're not really allowed to put pressure when you're about to go. So you're not allowed to push. So the Cleansing Plus really helps, for you to be able to release, better and easier. What has helped me in this pregnancy journey and even before that and even after is that I was taking PPARS. My husband and I were taking PPARS tablets. So that has helped me with, of course, the hormonal imbalances. It has helped us to regulate, and it has given us more energy and have healthier bodies. So it has no contraindication, so that could also help you. So you may try on your own and test it for yourself. Hi, I'm Nesta Vicencio, and here's my son, Ethan Kairos. So I had an amazing pregnancy journey and recovery with the help of Simply Nature PPARS. Thank you, Simply Nature. We love you.
Good morning, I'm Mrs. Melinda C. Hispano. Ako po ay na-diagnose ng stage 2B breast cancer and I'm from Muntinlupa City. I'm a public school teacher. Nung nalaman ko po na na-diagnose ako ng breast cancer, syempre may devastated po. And of course, the whole family, parang our world, falls apart, sobrang down. There is no symptoms eh. I just felt the lump. Dalawang lump siya sa right breast. And I was not really going for a check-up sa lumps. I was, magpapa-check up ako sa OB-GYN ko. And I was advised to go to the surgeon kaagad. So, after po ng operation, I was asked to go to oncologist. The protocol is to have 8 cycles of chemo and 33 radiation. When I was in the hospital, sa aking bed, browsing through the Facebook, I saw the face of Dr. Jansen. Sabi niya, makakatulong po sa mga chemo patient, yung Simply Nature PPARS. So if you will just try, malaking benefit po sa katulad naming mga cancer patient. I was advised to supplement chemo with PPAR powder saka tablet. So at first I was hesitant kasi very mahal po siya. Pero first chemo ko, taking PPARS, hindi po ako nahirapan. So I was expecting na yung mga nababasa ko, napapanood ko ng mga side effect of chemo. Hindi ko po siya naramdaman. So I was telling my family na parang maganda po yung PPARS sa akin. I finished the whole 8 cycles without any problem. Thanks to my doctor and the Simply PPAR. Kasi po, even my co-teachers, even my family, sabi po sa akin, hindi ka mukhang may sakit. So that must be a blessing from up high there, no? That I was able to meet Dr. Jansen and I was able to take Simply Nature PPAR. Latest result of my laboratory, all are normal. Yes, thank you, Lord. Continuous pa rin po yung tablet. So I just ordered 6 ngayong May. So that would last for ilang months. My latest ultrasound, fixed pa din po siya. No calcification or anything. So I thank God for that. Mapapayo ko po sa mga pasyente po na katulad ko, go to the right doctor, no? You pray for the right doctor. Kasi ako pinray ko lang para bigyan kayo ng the right supplements. And para yung journey nyo, yung cancer journey nyo, will be very successful. Kaya nga sabi ko, during my PPAR journey, sabi ko sa sarili ko na I will be the most successful chemo patient in the whole wide world. Thanks, PPAR. I will highly recommend po Simply Nature PPAR kasi based on my own experience, it helps me a lot talaga. And it's a blessing to me na take ko yung PPARS. Kaya nga ang sabi ko, I will be the most successful chemo patient kasi may supplement ako galing sa Simply Nature, which is PPAR powder and PPAR tablet. So, blend together, it helps me a lot. And I'd like to thank my daughter, si Cadiz, and also my husband for taking care of me. Hindi siya nagsisisi on that part. Thankful po siya. Kaya nga, nung sabi ko, a-attend kami, and he was very supportive, binatid niya ako dito. I am Melinda C. Spano. I'm a public school teacher. I was diagnosed with stage 2B breast cancer. Upon knowing my situation, it was really a very devastating event. I was advised to do 8 cycles of chemotherapy and natatakot ako dun sa chemotherapy. But with the help of Simply Nature, na-surpass ko, nakatulong po sa akin. It's a big help. Lahat po ng side effects ng chemo, hindi ko po naramdaman. So, I'm very, very thankful to Simply Nature because it really helps me a lot. And ang feeling ko, I'm a very successful chemo patient because of Simply Nature. I trust Simply Nature.
Okay, and we are live. Healthy day, everyone. My name is Jhen Lim, a licensed pharmacist and one of your trusted health advisors here in Simply Nature. We are an international distributor of food supplements made from a unique strain of microalgae called PPARS, which has been tried, tested, and certified to support not only cancer treatment, but also general health and metabolic syndromes like hypertension, diabetes, and high cholesterol. So whether you are diagnosed with cancer, caring for a loved one, or simply wanting to protect your health, this seminar is for you. Today's topic is about a resilient body, a comprehensive holistic roadmap to cancer wellness. And our goal today is simple: to understand how we can help the body become stronger, healthier, and more resilient while receiving proper medical care. So, first off, what does resilient body mean? And imagine two houses during a strong typhoon. So the first house has weak walls and a damaged roof, while the second house has strong foundations and well-maintained walls. So both of them face the same storm, but the stronger house has a better chance of staying standing. Our bodies work in a similar way. So, cancer is like a powerful storm. Medical treatments attack the cancer, but the body itself also needs strength. And a resilient body means better nutrition, stronger immune system, healthier muscles, better sleep, emotional strength, good support from family, and healthier daily habits. These do not magically cure cancer, but they can help people tolerate treatment better, recover more effectively, and improve overall quality of life. Cancer wellness is like building a house. So think of your body as a house. A strong house needs many parts working all together, and cancer wellness is the same. So today we will discuss 8 important pillars. Let's see. Pillar number 1, you have to nourish the body. Food is not just something that fills the stomach, okay? Food, it gives the body the materials it needs to repair itself. So during cancer treatment, many patients lose appetite. Some experience nausea, and others have mouth sores. So some lose weight rapidly, and even then, nutrition remains extremely important. So try to include, of course, vegetables, fruits, fish, eggs, beans, chicken, healthy fats like nuts or avocado when appropriate, and enough water. So protein, yan, is especially important because it helps repair muscles and body tissues. And if eating 3 large meals is difficult for you, you can eat 5 or 6 small meals na lang throughout the day. And because even small nutritious meals can make a big difference. And pillar number 2, stay physically active. Many people think cancer patients should stay in bed all day. And actually, unless the doctor advises otherwise, gentle movement is often beneficial. So simple activities include walking, stretching, light household activities, or simple chair exercises. Yeah. Physical activity helps improve blood circulation, reduce fatigue, maintain muscle strength, improve your mood, and support balance. Yeah. The goal is not intense exercise naman. The goal is to keep the body moving lang. And pillar number 3, quality sleep. Yeah. Healing happens even while we sleep. And, poor sleep can make people feel weaker, more tired, more stressed, and less energetic. So good sleep habits include sleeping at the same time each night, yeah, reducing screen time before bed, and keeping the bedroom quiet and comfortable, and avoiding too much caffeine late in the day. Moving on to pillar number 4, manage stress. So receiving a cancer diagnosis can bring, of course, fear, sadness, anger, and worry. These emotions are normal. Stress does not directly cause cancer, but long-term stress can affect your sleep, your appetite, and overall well-being. So we have healthy ways to cope include prayer, meditation, deep breathing, talking with family, joining support groups, and enjoying your hobbies. Remember, taking care of emotional health is part of taking care of your physical health. Now, pillar number 5, prevent infections. Some cancer treatments lower the body's ability to fight infections. So we have simple habits like washing your hands regularly, avoid close contact with sick people, keep wounds clean, practice good oral hygiene, and prepare your food safely. Pillar number 6 is follow your treatment plan. So we have doctors who design their treatment plans based on your cancer type, your cancer stage, your laboratory tests, and overall health, and with many years of scientific research and experience. So don't miss your follow-ups, guys. And pillar number 7, build a strong support system. We all know cancer is difficult to face alone. So we have family, friends, neighbors, church members, healthcare professionals, support groups. These people can help with your, let's say, transportation or meals, emotional encouragement, financial guidance, and daily activities. Remember that accepting help is not a weakness, it is a wisdom. Lastly, pillar number 8, healthy daily habits. Small daily choices add up. You should avoid smoking, avoid alcohol, stay hydrated, and maintain a healthy weight if possible. Protect yourself from excessive sun exposure, and even small improvements practiced consistently become powerful over time. And that's the power of small daily habits. Imagine placing one coin into a jar every day. One coin seems small, but after 1 year, the jar becomes full, diba? So, healthy habits work the same way. One healthy meal, one short walk, one good night's sleep, one bottle of water, one doctor's appointment. Small actions repeated every day create a meaningful change. Because cancer is a difficult journey, some days will feel hopeful, some days will feel exhausting. But remember this, you do not have to be perfect. You simply need to keep taking one healthy step at a time. Every nutritious meal, every walk, every medicine taken correctly, every night of good night's sleep, every encouraging conversation, these small choices work together to help your body stay as resilient as possible throughout your cancer journey. So now, to help us explore this topic more deeply and understand how we can apply these concepts in our daily lives, it's my pleasure to introduce our first speaker. We have a seasoned international speaker on a wide range of topics from personal success to healthcare, who is also the founding director of Simply Nature International. Our PPARS expert from Singapore, you all know him, is Mr. Shyan Lim. And it's an honor to present our second esteemed speaker, Dr. Jansen Kalalan, a distinguished graduate of St. Luke's College of Medicine. Dr. Kalalan is a diplomat of both the International Board of Lifestyle Medicine and the Philippine College of Lifestyle Medicine. He currently serves as an integrative oncology practitioner at several renowned institutions, including Alta Integrative Medicine and Wellness Complex of Perpetual Health Medical Center, Las Piñas, Tree of Life Wellness Center, Centro Holístico, Meta Medica, and Simply Healed Medical Group. There, he offers integrative therapies that complement conventional treatment and provides patient-centered care to those who have chosen to pursue their own path through cancer. Good evening po.
Hi, good evening. Good evening,
Good
Jen.
evening, everybody. Dr. Johnson, we are perfectly matched again. Dark and you are white and white.
Yes.
We are really a couple in a way. Okay. Come, let's go to our very first question, Jen. Yeah.
Okay, our very first question is coming from our website. The patient says, I have the CTA neck result. So number 1, severe stenosis at the left vertebral artery origin, but no occlusion. Number 2, no hemodynamically significant stenosis of the carotid naman. And my neurosurgeon told me that carotid surgery could be done. However, can that PPAR help to reverse stenosis na lang?
Well, you can you cannot use PPARs only.
Yeah.
That's what I wanna say. So this is stenosis. The strategy that I usually use for this is a combination of phosphatidylcholine infusion, chelation, and inflammation lowering strategies. So omega-3s would be one of them. So you can actually use Simply Nature PPARs for the omega-3 part. But basically what you need to do is to soften the plaque and then remove the calcifications slowly. So it's a process. No? My suggestion would be, if the surgery is urgent and if the surgery is urgent and if you trying to delay the surgery would cause more harm, then go for the surgery. But if the plaque is stable, your vital signs are stable, I mean, generally you're feeling okay and you can actually delay the surgery, then you can try the phosphatidylcholine infusion, chelation, and PPARS. We can try to dissolve it. But how long would the treatment be? It would be a lot of infusions actually. So you would need 3 infusions weekly for the next 6 months. At least for the next 6 months, yeah. Yeah. Because you need at least 30 to 40 weekly infusions of chelation and then 30 to 40 infusions, twice a week infusions of phosphatidylcholine. Yeah, so there you have it. So that would be a path that we can consider.
Okay, I just did a check on the possible mechanisms of action for how PPARS can help with stenosis. So there are 5 actually. Number 1, inhibiting vascular smooth muscle cell growth, overgrowth. So this will basically prevent abnormal vessel walls thickening. So it will not thicken. It will help to mitigate the thickening. Right, correcting endothelial dysfunction. So PPAR agonist actually restores vascular wall structure and correct the dysfunction. So this is one thing, right? Nitric oxide bioavailability. Okay, this one was actually something unexpected and a little bit new to me. So PPAR gamma ligands actually stimulate endothelial cells to release more nitric oxide and decrease other compounds that block nitric oxide production. So this helps to maintain open blood flow, right? Suppressing vascular inflammation. So we've talked about this many times before. And the last one is actually very applicable. PPAR gamma activation in platelets inhibits platelet aggregation. So it reduces pro-clotting agents, right? So this is to reduce the risk of sudden arterial blockages or basically stroke. So in short, these are what Simply Nature PPAR can support and assist. So like what Dr. Jansen says, at least I was able to give you some mechanism of action so that you can basically understand what happens when you take PPARs. But this must always, of course, be coupled with other forms of treatment. All right, but there you go. You have your answer from both Dr. Jansen and myself that it can help, but it must not be the only treatment that you're going, protocol you're taking.
Okay. Next question coming from Will. How does PPARS help a person with BPH?
PPH.
Through metabolic, by arranging you metabolically. So BPH is benign prostatic hyperplasia. So you have an enlarged prostate. Usually enlarged prostate arises from insulin resistance. So with insulin resistance, so that's type 2 diabetes actually, so you have to fix that. Okay? So lifestyle change with PPARS assistance, lowering inflammation, improving insulin resistance, then that can help patients who have BPH. But can it reverse the BPH? We don't actually have clinical studies behind that, but the mechanism with how BPH comes about, that one, PPARS can help.
So you're addressing the root cause, right?
Yeah, you are addressing the root cause. No, with BPH, if you're having symptoms like urinary problems, then that would warrant medication. So finasteride, dutasteride, tamsulosin, these medications usually.
So doc, for a patient like this, right, for illnesses like this, even what would be, from an integrative approach, what would be the time frame that you would normally advise patients who are using lifestyle changes? I mean, if they take drugs literally tomorrow, they will see improvement, diba? But if they do lifestyle changes so that they have a proper frame of mind, what is the time frame that they will see good improvements? A month, 2 months, 3 months? What must they be expecting to see a good progress in their illness?
Usually in a month's time, you would see improvement already. 1 month.
Okay. 1 month.
as long as you
But not
implement
2 days lah. But not 2
no, not
days.
2 days. Of course, not 2 days. So some patients, if they do it consistently, sometimes 3 weeks, 2 weeks, 3 weeks, they would feel significant
Wow.
changes already. Okay, so this is just talking about lifestyle. Okay,
Hmm.
this is without the medications, because with medications, of course, that within 1 week you'd feel improvements already. Okay.
So if you do both, you will get long lasting.
Yeah. So
Both the fast and the long lasting.
yes. So the strategy is not just to address the symptom, it's also to delay the disease, and if possible, reverse it. So that's the strategy. That's why we cannot rely on a single or two medications or supplements only. So so basically what you're trying to do with the condition is to halt it in its progression, then try to reverse it if possible. Okay.
So for this particular patient, I would recommend a combination of soft gel capsules so that you will see results a bit faster, right? And combine it with tablets. So maybe 2 soft gel capsules, one soft gel capsule twice a day. I think if you finish one blister pack, that will be a good jump start already. And then at least 10 micro tablets 3 times a day, because you want a therapeutic effect. And together that with your lifestyle changes, you're going to see big improvements in your metabolic syndromes. So we're talking about your diabetes, blood cholesterol, all that. And that's definitely going to help with your hyperplasia.
For sure. Okay. Next question coming from Miss Leslie. I am switching to PPARS powder next Monday after 30 days of using the PPARS vials.
Okay.
What will be the exact dosage of the powder and tablet for my second month? The diagnosis is colon cancer stage 3B. Thank you.
Doc, what would you recommend for this?
I don't know. I have to see the inflammation, inflammatory level.
Okay. As Doc said, you are not giving us enough information, because number one, we will want to know what was the improvement after you've been on 30 days of the liquid, so on and so forth, right? However, I think as a rule of thumb, if you're coming off the liquid, I would say 1 to 2 scoops 2 to 3 times a day. All right. And you can, I'm giving you a range because we don't know your condition. If your condition is very positive, then perhaps 2 scoops, two times a day, 1 in the morning, 1 in the evening, right? That would be a good way. Now the tablets is, I will always say 10 micro tablets 3 times a day minimum. All right. The reason is because the tablets is actually your nutritional supplement now. All right, it's giving you all the multivitamins and all that. So you're already eating healthy, I hope. Okay, but even though we eat healthy even in Singapore or Philippines, it's not easy. It's really not easy to get everything that you need in your meals every day, right? I actually have patients who try Gerson therapy for cancer. They actually got burnt out trying to get the vegetables because they are very specific. It's not just celery, it's what
Person
type
is like
of
that.
celery. Yeah, they got burnt out. They had to travel to Baguio in order to find the vegetables that they need, and they got really burnt out. So I'm just saying that realistically speaking, even if you do try to eat healthy, there will always be some deficiency because it's not easy. It's just not easy. So this is why the tablets is a great all-rounder supplement, which also supports your PPAR extracts, but it also sort of round off any deficiencies in your diet, right? So that's why we say 10 micro tablets, because in the end of the day, you're just eating algae. So if you eat a little bit, by grammage, by weight, there's only so much vitamins and minerals there. So you have to eat enough, all right? So minimum 10 micro tablets 3 times a day. For the powder, maybe you can start with 2 scoops twice a day. If you want something clearer and more specific, then have a consult with Dr. Jansen so that you can share with him what's the progress after the liquid, Yeah.
So for those of you who wish to have a consult with Dr. Jansen Calalan, you can schedule an appointment using the link in the description box and comment section below. Our healthcare specialists, Miss Beth and Miss Irish, will reach out to you shortly. Next question coming from Lindsay. Is PPARS applicable for PCOS?
Oh, yes. Okay.
Yeah.
I actually attended what's that called? I attended a Prima event and a doctor actually asked this question. Before I could answer, another doctor actually stood up to answer for me. So that was Dr. Lizo. He was just sharing he has very good results with PCOS, with soft gel capsules. The next time I'm in Philippines, I should visit him so that I can find out a bit more. But yeah, he was just sharing it was very good for his patients. So you can try. No harm. Yeah.
Okay. Next question coming from Ms Remedios. I have gastric cancer stage 2. What can I drink from your medicines?
Oh, what would you get? Gastric cancer. What is gastric cancer? I mean, stomach
Stomach,
cancer, right?
stomach
Yeah.
cancer.
So, doc, for stomach cancer
Um,
as an integrative doctor, what are the key things that you think about?
I would be very worried about bleeding
Okay.
because stomach cancer or gastric cancer tends to bleed.
Oh,
Now,
wow.
so this cancer,
Mm,
if you don't have bleeding, or if you're not coughing out blood or vomiting blood, then PPARS would be okay. But
mm,
if you're someone who has a very high risk of bleeding, then I
mm,
won't advise PPARS.
mm.
Why? Because the color of the supplement can mask out the
Oh,
blood. So you won't actually know if you're already bleeding or not.
mm,
Because yeah, the colors, basically PPARS will darken out your vomit. So you would have to stay on foods that are light in color. Another issue is if you ever you're going to take PPARS, I would advise against the soft gel and the liquid because they have higher omega-3 fatty acids just because
mm.
um the liquid is a liquid.
Yeah,
Soft gel inside them is liquid.
yeah.
Um so these preparations usually have higher omega-3 fatty acids which can thin out the blood. Okay? So I would choose the powder. The powder would be the best choice for this one because the powder you just dissolve it in your mouth. It doesn't pass through the stomach at if at all, no? So the strategy there would be to take it in small amounts more frequently. Like a scoop every hour, every 2 hours.
Mm.
Like so. Okay, so
Okay.
that would be the one that I would be very worried about. Bleeding. Yeah, because patients who have gastric cancer can bleed out to death.
Oh, okay. Okay.
Yes.
So when a gastric cancer patient is bleeding, how do you actually stop the bleeding? Or what do you do to minimize the occurrence of bleeding in stomach cancer?
Well, number one, you cannot be on blood thinners. Number one.
Okay.
Number
Okay.
two,
Hmm.
you have to undergo chemo.
Okay.
Chemotherapy is a must.
Why, doc?
Because
Why?
because chemotherapy can clot out or minimize the bleeding in the stomach
Okay.
in stomach cancer. So chemotherapy would be very useful in this situation. Um Aside from that, if you're actively bleeding,
Mm.
well, you have to go to the hospital. Probably be admitted under surgery and they would have to do some procedures just to stop the bleeding and do an endoscopy perhaps, right? So yeah, you have to be admitted in the hospital emergency. Mhm.
So if you're not bleeding, then please do take the PPAR so that you improve your condition and then you don't reach that condition where bleeding becomes
Yep.
more and more likely, right? So that's why to all our audience, we always share, right, that for cancer, the moment you're diagnosed with cancer or even a tumor, right, you can start doing things. Start taking, for example, supplements because supplements are not like drugs. They don't have that side effects, especially natural plant-based whole food supplements like Simply Nature, where it's things that you can already do to even before you know whether your tumor is malignant or benign. right? Because you want to get other things in order, like your metabolic syndrome, so that later you will have less complications. So even bleeding itself is not the actual cancer, diba? So these are things that if your if your blood works are normal, you won't need either thickeners or thinners. So you won't be on a thinner in the first place if your blood works are normal. So this is why it's so important as a cancer patient or someone that has a cancer scare. The best thing you can do before you confirm, it takes some time before the results come out. The first thing you can do is already try to bring your body, the rest of your body, to a healthy state, right? The healthier your blood works are, the more options you have, the less worries that you have when you find out that you really do have cancer. So again, take action quickly. So supplements like Simply Nature PPARS are very beneficial for all the metabolic syndromes and also all the things that are cofactors or determining factors in fighting cancer and of course in preventing cancer.
Okay. Another complicated question.
Wow, okay. That's why today I'm so glad Dr. Jansen is here. Last week we had no complicated questions.
Okay. Coming from Pio. I'll be going for D&C with hysteroscopy in August. For now, the diagnosis is endometrial hyperplasia without atypia. So, what is the recommended product for me?
You don't actually need one.
Okay, please share with us what it means. I'm sure the patient herself also wondering what this means. It's all very big words to all of us. Yeah.
Basically, let's break down the terms used. So I'll start with the
Mhm.
diagnosis
Okay.
before we get into the procedure. So
Mm.
endometrial hyperplasia is when your endometrium just thickens, no? But this is without atypia because atypia means the cells in your endometrium actually changed into more cancer-like characteristic. So yours is without atypia. So the
Mm.
endometrial hyperplasia is just a multiplication of your endometrial tissue. So it just
Mm.
basically thickened out. Okay? And
Mm.
this might be causing bleeding. I would guess you would have bleeding. Okay? That's why you would seek medical medical attention. So that's what endometrial hyperplasia means in simpler terms, no? It's basically your endometrium's tissue or cells just multiplied in number. So it thickened. Okay? So now, what do you do to thin that out? So basically, what you do is to do a hysteroscopy. So a hysteroscopy has two words combined into one. Hystero means uterus. Scopy means scope or looking into through a scope. So hysteroscopy is looking inside the uterus using a camera or a scope. Okay? So that's what hysteroscopy is. DNC means dilatation and curettage. So dilatation and curettage means you dilate the cervix and you curettage. You scrape off
Okay.
the endometrium. Okay?
Okay.
When you scrape off the endometrium, that's how you thin out the
Ah.
the endometrium. And then those scrapings you send to pathology for them to analyze if truly there are no cancer cells. And with what you've mentioned, endometrial hyperplasia
Without
without atypia, that is the diagnosis
so good
of what
news.
they found from the scrapings.
Ah. So that's good news. You don't have a cancer scare.
Yeah, so the procedure already is the cure. So now what you have to address now is why you had an endometrial
Yeah.
hyperplasia in the first
Why?
place.
Why?
Hormonal imbalance. So you have
Hormonal
excessive
imbalance.
exposure to estrogen. Okay,
Okay.
so estrogen is the one that thickens the endometrium.
Okay.
Okay? So now you have to find out why. Where is the excessive estrogen exposure coming from? So that can be from your food, from the utensils that you're using, personal care items, these things. Okay, so you have to detox.
Okay.
PPARS
So
actually is a very good detoxification product, but you cannot just rely on a single product. You have to the detoxification process has to be structured. Okay, so clean your gut, sweat out, these things.
So basically, it's good news, not cancer. Second thing is start to live a healthy lifestyle. All right, and in the coming months, things will start to work out. Your body will maintain the procedure. Like Dr. Jansen said, the procedure itself was already the treatment, right? And you get healthier and healthier. So I would recommend to you tablets, right? Just take micro tablets. Take more, right? 10 micro tablets 3 times a day, and then start to live a healthier life. All right. Exercise, a very important exercise. You know, for me, I'm 52 years old. I make sure, except for this last 2 days because I have foreign guests in Singapore. But every day I actually brisk walk 1 hour minimum. All right. And then I'll do some additional exercise because I need to maintain. I need to look as young as Dr. Jansen. Or else, if I stand beside him, people think I'm his uncle or something. All right. So, so very important, right? You gotta take care of that. So, like we all say, it's very difficult to eat healthy, even when you do try. Even when you do try, sometimes you are lacking here, this and that, right? So, for example, I just got some vitamin D supplements, right? Because even though I have PPARS, right, the amount of vitamin D in PPARS is not super high for what I need, right? So I still take my PPARS, right, because it covers a broad spectrum, but then there are some specific needs that you may need. So for you, if you're not sure what specific needs you need, then let's cover everything first in a natural, wholesome way, right? And then on top of that, make your lifestyle changes. And after you do this for 1 or 2 months, you can always then explore what more you can do, right? But by then, you would have already seen some improvements in your general health. And then it'll be easier to identify any other places you need to adjust, all right? So why don't you start the tablets and then after, and very, very important, a good suggestion would be maybe after taking the tablets for 2 weeks, you have a consult with Dr. Jansen, and then he will also be able to see what's the progress and anything, any shortfall areas that maybe other improvements that we can do.
Okay, all right. We're almost at the end of tonight's session. This will be our last two questions for the evening. So first one coming from Mr. Ronnie. What PPARS can you recommend for renal mass? They want to remove my kidney. I am thinking twice about going for biopsy.
No, I think number one, go for the biopsy, right, Doc?
Okay. I will only discuss standard of care here. Okay.
Standard of care, which means this is not a consultation, right? This is just information.
Yes. How would I approach this situation? Okay. You have a renal mass. I don't know what kind of renal mass you have, but let's assume that it is malignant. Okay, it looks like it's malignant. So if you have renal cancer actually doesn't respond well to chemotherapy. They usually do targeted therapy and immunotherapy for that. And the mainstay of treatment is surgery. Okay. Now, with these tools, a biopsy is needed. The biopsy is needed because the mass, you have to rule out cancer, basically, because the mass can be benign. It can also be malignant. So
if it's benign, will the treatment be different?
The treatment would be different if it's benign. If it is benign and if the mass is not producing symptoms, then you can actually leave it there and just monitor. Or you can take it out. Okay? If it is malignant, then you have to take it out. Okay? So that would be standard of care for renal cancer. Now, I will not say I will not answer the question, what can you do if you do not want to pursue biopsy or surgery? Okay, I won't answer that. But I will answer what other things you can do to help these kinds of patients.
Okay.
So one procedure would be hyperthermia. Okay? Hyperthermia especially the wait, let me try to recall the term. Capacitive, especially capacitive hyperthermia. Capacitive hyperthermia is where you lie down on a bed and they actually place a probe or sort of like a probe with a plate on it on your stomach. Okay, so that probe your body and the bed that you're lying on will form a complete circuit so that heat and electricity can go inside your body. So the purpose for this is to heat the tumor from the inside. So with heat, the cancer cells will die. Okay, so that's one. So this is mainly used as an adjunct for inoperable tumors. Okay, but you have to use it as an adjunct. Okay, that's where the evidence is. So aside from hyperthermia, what you can do is to do a liquid biopsy as well. So the liquid biopsy will show you what drugs and natural substances can actually kill the cancer cells. So because what they will do for liquid biopsy is they will get the circulating tumor cells, and the circulating tumor cells, they actually use different drugs and natural substances and test it in the laboratory setting, and you will have a roster of which medications actually killed the cancer cells. Okay, so this is on a different level, it's a very sophisticated test, no, because to get circulating tumor cells you need to have very precise machines, very expensive machines, because it's very difficult to get circulating tumor cells in the blood. Also, you have to make sure that the cancer cells that you got from the blood, they don't die. So, yeah, they don't die during the collection or the isolation. They only die when you actually test the substances on them. So that's what you try to do. There are also liquid biopsy procedures wherein they get the ctDNA or the circulating tumor DNA inside your blood. These tests value it comes in for targeted therapy, immunotherapy, because with certain parameters they would actually know if the probability of the treatments working would be high or low. So again, what I'm saying here is probability. Okay, it's a different thing. It's a different it's a different thing when you say when you're actually testing the medication on the live cancer cells. So these are two different procedures. So I would actually choose the test for the wherein they get the actual circulating tumor cells, the live cancer tumor cells, because they actually see function. Okay. So that's another thing that you can do. Yeah, and then all the rest would be supportive. Okay. Yeah. So there you have it.
So I think this gentleman is definitely very concerned, doc, because if he
Yes.
loses a kidney, I don't know what is his age. Let's say if it's late 40s or early 50s, that's still a lot of his life that is going to
Yes.
be
That's
affected.
bad news actually.
Yeah.
So it's a renal mass, but of course, if it's only on one side, then you can actually live with one kidney
A
alone. So you
normal
can
life, but of
yeah,
course
a
you
normal
just
life.
have to be
Yes.
definitely
Yes. Yeah. But if it's
conscientious.
on more conscientious, but if it's on both kidneys,
Oh
then
wow.
that's bad news, because if you take them out, you have to be on dialysis for the rest of your life, right?
Yeah.
The
Or
only
kidney
thing that
transplant.
would save you is a kidney transplant. But definitely, the mass would have to be taken out. So it's a matter of, is it in one kidney or two kidneys?
So all the more for this particular viewer, don't delay, because if you delay and the cancer spreads, then it may not be one kidney, right? So
Yes.
in cancer, don't delay. So I would suggest to you, as Dr. Jansen probably has given you hope as well, as he mentioned there are other protocols, but and he cannot answer that question that you first asked, because that would be just irresponsible of us. This program is educational. It's supposed to help you think enough to be able to ask your doctor more questions or to make a better decision. It's not meant to be a consultation. So I would just advise you to have a consultation with Dr. Jansen. At least you also know Dr. Jansen has other protocols in his mind that you might want to consider. So I think the best thing for you is have a consult with him and do it quickly. Do it as soon as possible. His next open schedule. And in the meantime, if you want, probably you can start on a soft gel capsule or something or tablets, right? Just get your body in a better condition so that whatever Dr. Johnson gives advice to give you, you are in a better position to take any option available. Even if you need to go for surgery to remove the kidney, you also need to make sure your body is healthy, your blood sugar levels, your cholesterol levels. All these things affect the success of a surgery as well. So the moment you know that you need to go for procedures or you can start to do preparation work. So Simply Nature PPAR tablets and soft gels are very ideal supplements that will just help you in this area. Okay. Yeah.
Okay. Second question coming from Jefferson. Can PPARS replace pain relievers for cancer patients?
Okay, no. Okay, if you need pain relief for cancer, it's pretty bad, right? If you really need pain relievers for cancer, it's pretty bad. Now, Dr. Johnson has actually explained this before. Can Simply Nature PPARs help with pain for a cancer patient? Yes, because pain is often caused by inflammation, right? So if we are able to manage inflammation, we are actually managing the source of pain. But if you're already on pain medication, it's not just inflammation alone like this. So helping manage inflammation is not going to be the same level of pain relief as, for example, on morphine. So this one I know personally because I've met bone cancer patients. You know, they've tried to take PPARs to see if it helps. It helps, but they will still need their pain medication. Even though it helps, it's not going to help enough to be able to let you sleep at night. Yes, it's still going to be so painful, right? So same for my grandma. My grandma actually had leukemia, 90 plus years old. So the last few weeks, I think she was actually on morphine in the hospice, right? Yeah, so I just want to let you know, nope, it's not effective as a pain reliever for cancer patients suffering from pain. But it will help with the pain because it manages inflammation. But if you're already on pain medication, it will not be enough. You won't be able to go off pain medication because of that. Yeah. Okay. Jhen, you got one last question, right?
Yeah,
Really
one
quick one.
last question. Sorry
All
po.
right.
Coming from Miss Tanya. AD Pro is food grade, right? Can I put
Yes.
it in mouthwash?
No, the answer is no. It's food grade, but it's not designed for you to put on your tongue. All right. So the answer is no. And right now I can't actually even answer you because I need to check. I mean, theoretically, is the bacteria microbiome on your tongue even the same as your skin external, right? So the probiotic is actually a specific type of bacteria designed for a particular environment. So this one is actually designed for your outside skin, all right? So I don't think the bacteria on your outside skin is the same as in your mouth. So no, the answer is no. Yes, it's food grade. Is it safe? Yes, but it's not designed for you to take the AD Pro and do this. It's not like that. It's safe because when kids lick it, you know, when a child, you put AD Pro on a child or you accidentally put into your mouth, you don't need to rush to the toilet to wash it out. You don't need to freak out and worry, is this going to poison my kid or anything? Like, for example, if you take steroid cream and then your baby licks the steroid cream, you'll be very concerned, right? Okay, so AD Pro is food grade. It doesn't give you all these concerns, but you're not supposed to just take it and put it in your mouth, all right? Yeah, so the answer is straight no.
All right. It looks like we've covered all our questions. So as we wrap up this evening, we'd love to hear your final thoughts for our viewers.
Go, Doc.
Okay, I'll go first. Final words. This goes out to my patients and also not my patients. So everybody
Okay.
who are seeking healthcare right now. I know the procedures, the treatment protocols that your doctors are recommending might be challenging to follow or whatever reason it may be. It can be sometimes. Don't be shy to go back to your doctor and tell them that, hey doc, I cannot follow what you're recommending. I have my challenges. Can you please um can we please re-strategize? Okay. So usually sometimes Filipinos have the tendency to be shy when it comes to
Doc.
raising their concerns. So this is cultural. Okay.
Okay.
Even in conferences, Filipino doctors would usually be shy to ask questions. Okay? Most of them. So this is in stark contrast to conferences that I have attended abroad wherein they just, barrage the speakers with questions.
Yeah.
Really. So this issue or this shyness or meekness or what's the right term? Meekness probably. I don't know if it's the right term, but this can actually work against you. Okay. So please tell them. Be upfront because I mean this is your body and we're trying to help you. The doctors are trying to help you and you have to tell us and give us feedback that, hey doc, we cannot do this? Can we make the protocol easier or can we make the budget a little bit lower? Something that we can realistically afford because
Yeah.
the tendency is us doctors would always recommend the best for our patients, and it would be wrong for us to judge you based on how you appeared in front of us in the clinic on your
Yeah. Yeah.
capacity to pay.
Yeah. Yeah.
That's wrong. Okay, so we cannot we cannot base our treatment protocol on that. It would be just so wrong, okay,
Yeah.
on all levels. Okay, so you have to actually tell us. All right, so that's the message that I want to put out there. And good night, everyone. So I'll give the floor back to Sir Shen. Bye.
Okay, I think that's actually a very heartfelt plea from Dr. Jansen that really voices out what he knows. Because Dr. Jansen is one of those doctors that I think patients don't have a problem asking questions to, right? He's very warm and very likable. So his patients makes his patients comfortable to ask him, right? And of course, when Dr. Jansen does programs like this, over the years, we've been doing this for 5 years. I think Dr. Jansen also his persona, that means when he talks to patient, the way he talks to patient has also changed over the 5 years, become even more warm, even better able to connect with his patients. So yeah, so you can start your journey of being able to voice out and ask more questions by having a consult with Dr. Jansen lah. Because after you have a consult with Dr. Jansen, Dr. Jansen will also give you questions that you can ask your surgeon, for example, right? Because sometimes you may be shy, you don't know how to ask your surgeon questions, you don't know what questions to ask your onco. So for our viewers out there, sometimes you don't to have a consult with Dr. Jansen might not mean that you just use Dr. Jansen's protocols. It might also be helpful to you to know what questions to ask your other doctor. For example, after meeting with Dr. Jansen, you'll be equipped with more questions for your oncologist so that you can then decide what to do with your next step in your treatment. Okay. So again, for the person who who brought up the question about the kidney, please have a consult with Dr. Jansen quickly so that if we can save the kidney, great. The worst thing that we don't want to happen is that whatever is happening in one kidney starts to happen in the other kidney. Then if it spreads like that, then it's most likely, malignant, and that's not good because if you wait and you have to remove both kidneys, it will really mean a total change in your quality of life, right? A total change. Everything will be different, and it will also be very costly. If I'm not wrong, dialysis is almost like 6 to 12,000 pesos every week for the rest of your life. You can just imagine how draining that could be physically as well as for your family in terms of finances as well. So please, we are believing for the best. Quickly make decisions, and you can start on things like tablets 10 tablets 3 times a day, soft gel capsules, all right, just to get things started, right? Get your diabetes, your blood cholesterol, all these things normalized even now, so that when the decision comes, all the options are available. You can make it, and then you can recover fully. You can recover fully, okay? The best worst case scenario is you will save one kidney. So you will still have one kidney, which means you can live a normal life. It's just that you have to be conscientious, cannot eat fried chicken breakfast, lunch, dinner every day, right? But you can still eat fried chicken regularly. You get what I'm saying? So that's the best of the worst case scenario that we can achieve. So, and then there'll be ways for you to get back your health. All right, get back your health. Okay, so with that, I just want to wish everybody thank you for joining us. We've been doing this for 5 years. We're still doing it. And today is actually very interesting. Lots of technical questions. Caused me to do some search while I'm on the program as well. So looking forward to next week to hearing from more of you again. Wishing everybody a healthy week ahead.
Thank you so much to our experts, Dr. Jansen and Mr. Shyan Lim, for that very insightful and empowering discussion. If you have any follow-up questions, don't worry, we will answer each of them next webinar or via direct message. So we hope to see you again next week for another empowering session, same day, same time, every Thursday night at 7:30 p.m. But before we officially sign off, we'd like to share some exciting ongoing promotions from Simply Nature. So if you've been dealing with stubborn eczema, psoriasis, acne, rashes, or any recurring skin irritation, except for thrush, try AD Pro. It's a probiotic serum designed to support your skin barrier, calm irritation, and help rebalance stressed out skin. And the best part, buy one, get one promo is still ongoing. It's available now on Shopee and Lazmall official website and via direct order. Moreover, if you buy a PPARS powder jar or a PPARS liquid vial, you will automatically get a free AD Pro serum, giving you both internal cellular support and external skin nourishment in one powerful promo. Meanwhile, customers who purchase the PPARS soft gel capsule, Tri-Pack Blister will also receive a free Renew mask. And as part of our commitment, we're also happy to announce that our free nationwide shipping promo continues for PPARS powder jar and PPARS liquid vial exclusively for orders placed through our official website, that's www.simplynature.asia. And we do all of this because we know cancer doesn't rest on weekends. So Simply Nature office is now open on Saturdays to better serve our clients. You may now place online orders and schedule product pickups every Saturday from 10 a.m. to 5 p.m. Pickup location is here in Capital House Building, Fort Bonifacio Global City, Taguig. And for this upcoming Saturday, get a quick health advice with genuine care and support from someone who understands how it feels to be in your journey. That would be Ms. Sheila Sampaio. So thank you once again for watching Simply Nature webinar powered by SMG or Simply Healed Medical Group, because your curiosity and victory about your health condition is what fuels our mission. Here in Simply Nature, we're always with you from the start to healing.